everyone, welcome back to the Peak Sports Psychiatry Podcast. Today's episode is brought to you by our friends at 43 Degrees Sports, a company that's actually revolutionizing post-game recovery. If you've ever thrown your gear into a bag and forgotten about it, you know the smell I'm talking about. 43 Degrees Sports created a temperature-controlled hockey bag that kills up to 96% of harmful bacteria. No chemicals, no noise, no hassle. It's clean gear ready to perform. Check them out at 43degreesports.com and see why hockey's dirtiest secret just met its match. Welcome back to the Peak Sports Psychiatry Podcast, where we explore the mental health side of performance, identity, and life in and beyond sport. Today's a really special episode for us. We're joined by an incredible team from All Points North: Courtney Messina, Ros Wilson, and former NFL player and coach Michael Wilhoite. We're also excited to share that this conversation marks the beginning of a formal partnership between Peak Sports Psychiatry and All Points North. We'll be collaborating to provide outpatient psychiatric services for athletes and executives transitioning from higher levels of care. We're truly grateful for the opportunity to work together and for the work your team is doing.
Yeah, Mark, this is going to be a great discussion, especially because we're diving into topics that don't always get enough attention. Group therapy, stigma, we've talked about before on the podcast, identity, and what is actually helpful to athletes engaging in care. So really, really excited to be with y'all.
Awesome. Well, I just want to get to know everybody. So, Courtney, can we start with you? Can you share a little bit about your background and your work with athletes, and particularly from your time at TCU and now at APN?
I sure can. Thank you again, Mark and Tommy, for having myself and Roz and Michael here. We're really excited to be spending some time with you all this evening. But without further ado, my name is Courtney Messina, and I am a licensed professional counselor supervisor in Texas and in Colorado, as well as a licensed chemical dependency counselor in the state of Texas. I'm based out of the Dallas-Fort Worth Metroplex, and I have been in behavioral health since 2014. I happen to be a former Division I college athlete. I played women's soccer for Southern Methodist University here in Dallas my freshman year, and then I transferred to Ole Miss, where I played both my sophomore and junior years of college. As far as my professional backgrounds, I have been with All Points North now for going on 2 years. I was originally more in an operations role, and I have recently transitioned into the role of director of community outreach for the organization. And both of my roles have been heavily involved with our elite athletes program. We treat a lot of athletes coming from the NFL, the NHL, Major League Baseball, and both my roles with APN have really been centered on building relationships and partnering with other providers and entities to really just figure out how we can best support the mental health needs of our elite athletes within the community. And so it's great for me to not only have my administrative outreach role for APN, but I'm grateful I'm able to be a contract therapist for Texas Christian University here in Fort Worth. I've been a contract therapist with their athletics department now for 3 years, and I've gotten the pleasure to work with a whole variety of different sports from football to volleyball. I've had folks on the equestrian team, swimming, diving, track and field. So it's really been great to have a couple of roles where I'm providing direct client care. And then as of a couple months ago, I did join the provider network for an organization that provides a lot of peer-to-peer support for the National Women's Soccer League and for the Major League Baseball Players Associations. And again, just grateful to be able to be in multiple roles to get time with the athletes from a direct care lens. Thanks again for having me.
Awesome. And for those of you who don't know, Courtney's somewhat of a cruise director for All Points North, and she was the way I actually got in to meeting with the organization initially. So she's a good friend. Next up, Roz. It's been a while since I saw you at the last conference, but would love to hear about your role as a group facilitator, also your background into the Olympics, and what drew you to working with your athletes.
Sure. Yeah. Well, thanks, Mark, and nice to see you again. And I also was drawn to APN by Courtney as well. She's brought us all together. So I'm a licensed clinical social worker. I'm actually based in Colorado Springs, Olympic City. From the UK originally. I've been a social worker for 18 years now. And I've kind of had a dual path. I've always been a social worker and a therapist. And then I was an athlete myself. I competed for a really long time in the sport of kickboxing, 10 of those years with Great Britain. And so I've kind of had this parallel journey as an athlete. Then when I was coming towards retirement, I was coaching more. And then I became involved in the Olympic movement, and I worked in the Rio 2016 Olympics and the 2020 Olympics and kind of a lot of those in between. And so I've kind of had that journey through being an athlete, working with athletes, and being a therapist. That's kind of led me into my role now. And I work for APN in two roles. I'm the clinical assessment coordinator. So I am the first therapist that people speak to when they come to APN. So right at the beginning, I assess kind of their needs and level of care. So I'm the first voice they speak to. And then I am one of the therapists for our telehealth intensive outpatient program for our pro athletes. So I plan curriculum and facilitate the intensive outpatients. And recently I started a mentoring project for our athletes as well. And tomorrow I'm training up a group of 10 athletes to become mental health first aiders to come back and work with our athlete population. I am a real strong believer in the power of storytelling and mentoring, especially in this population. So that's been a really great, unique piece of work I've been able to kind of do through APN. And so, yeah, that's kind of my role and what's led me into working with athletes, just that kind of practical firsthand experience, my therapeutic experience, and then kind of merging the two together.
Amazing. And, your past as an Olympian, you get immediate buy-in with athletes, no doubt. And you're like an ideal person then to lead a group to then teach them to coach their peers. So amazing. Michael, last but not least, your perspective as an NFL player and coach is incredibly valuable. Can you share your journey and how you got involved in this work?
Yes, sir. First and foremost, thank you, as Courtney said, to Mark and Tommy. And it's an honor to be on here with Rod and Courtney, people that I think highly of and that I know do a heck of a job in this world. And I'm just thankful to be here. But my journey, where do I begin? I'll start with college. I was a D2 athlete. I'm from Kansas. I played at a D2 school, Washburn University in Kansas, Topeka, Kansas. And from there, I actually played in the UFL first before I got to the NFL. I wasn't a superstar player at any level, honestly, was just a hard worker and loved to compete. I had the genes and good traits of perseverance and work ethic, and those things carried me a long way. And so played in the UFL for a year and then got an opportunity to try out for a team in the NFL, the 49ers, and ended up making it and then stuck around there for 6 years. Played 1 year after that with Seattle in 2017, which was my last year playing. So got to play in two beautiful places, also very expensive, but very beautiful nonetheless. After I got done with the NFL, I tried to figure out a new trade, a new avenue. I wanted to be at home, be a dad, but football was calling me. Just the game, the competition, the lifestyle. And I just felt like I have all this knowledge of the NFL, right? Not the X's and O's, not the how to play, how to do this technique, but how to handle the rigors of all the temptation that comes with the NFL, all the financial burdens that come with the NFL, and all those adversities that we go through as professional athletes, and especially in the NFL. I figured I'd go back and give that knowledge back. And so I called a couple coaches and it worked out. Next thing you know, I was coaching. I've coached the past 6 years, coached 2 years with the Saints, 2 years with the Chargers, and then 2 years with the Broncos. And I think if this podcast was probably 2 weeks later, I'd be announcing another coaching job. So everything looks promising. It's very excited for it, and can't wait to share all the things that I've learned from Ros and from APN. And so which leads me to, so I went and spent 30 days at APN, All Points North up in Edwards, and I had heard about it from other former NFL players, and they talked about the opportunity to spend that amount of time with yourself, learning about yourself and learning tools and techniques to help yourself position yourself to be in a better place on a day-to-day basis, and to disengage with the identity that we all have as professional athletes and as football players. And at the time, I felt like I needed it. I felt like it would be a great opportunity for me. I had some time, and so I went, and it truly changed my life up to this point. I went in October of 25, and I can truly say, I said this to somebody today, every relationship I have in life is better since I got done with APN. The way I communicate with people is tenfold. And just the way I relate and communicate with my kids and my wife, everything has just grown. And I feel like each month, even since I've left, I've just grown that much more, got that much better. And just the ability to recognize how I'm feeling, those emotions, and to be aware and present in those moments. So I'm excited to be here and to share experiences and knowledge and to listen and learn from you guys. And so I appreciate it.
I'm excited
Thank
to
you so
jump
much for
in,
being
Mark. And
Please.
Michael, congrats on the upcoming announcement. We'll have to have you back on, have you talk about that. And, what I hear is this community that you've jumped into and, paying it forward to other athletes and coaches and integrating this kind of mental health, support tools, as you mentioned. It's just going to create a ripple effect and affect so many more people. Mark, I think it's important for us to talk about like our relationship. At least I didn't know anything about All Points North until the fall. We were able to go visit the Edwards and the campus. Oh my gosh, it was a beautiful place. First of all, who wouldn't want to spend time there? But more than the place, I think it was the people, right? And hearing Ros speak, who wouldn't want to open up to her? And Courtney rolled out the red carpet for us too. We were able to talk about sports psychiatry and have that forum there. I think was really the start of something special. So excited to talk about some stories. Maybe let's start with something foundational, which I think we've talked about on the podcast, but we've all talked about stigma. And Michael, you just talked about a long career in collegiate professional football, and then it took you until you went to APN to learn some of these tools. So what is the barrier? Maybe open up to everybody. How much of this is structural barriers for players and coaches to get access to mental health and performance support? So whether it's time, whether it's confidentiality or access to resources, and how much is stigma? I imagine it's a little of both, but anybody want to jump in? Maybe I'll call on somebody. Michael, I'll kick it back to you. You've got the perspective from a player and a coach.
I think it's all the above. I think it's time, right? As professional athletes, we are so devoted to the craft, and we devote every second to that craft. And then when you're not devoting time to that, you want to rest. Man, I just want to put on something on TV or open up, just let my hair down and let my brain relax for a second. I think also the stigma is huge, right? It's a weakness, right? As athletes, we are thought of as elite human beings, elite people, especially professional level. And so when I say elite human being, different than elite athlete, elite human being, that's thought of by our parents, by our kids, by friends, by everybody around us. And so now, you mean to tell me that I'm going to let somebody know that while I'm not perfect, there are some things that I have to deal with? And now I could be viewed differently at my job by my coworkers, by my bosses, by my coaches, because I have said, hey, I need somebody to talk to because I don't know how to deal with these different emotions I'm feeling, the pressure that weighs on my shoulders each and every game, each and every day. And so I think it's time, I think it's stigma, and I think it's just that weakness part of, hey, we want to be these big, macho, tough, elite human beings that everybody around us has said we are, and we've worked so hard in our life to become, and we'd hate to tarnish that any type of way. And I think that that's the mindset still that my profession has when it comes to mental health and therapy. And I think it's just something that has to be continued to talk about the way we are in a positive light so that people can understand that it's not something that's wrong. It's something it's an acknowledgement of strength that you're willing to go have that conversation.
Yeah. Amen. Amen. Oz, you want to chime in on that? From the therapist perspective, what are those maybe barriers that you see for people coming in to get help with their mental health or performance?
Yeah, I think like there's an overwhelming kind of consensus when talking with the guys once they do come into treatment that that it wasn't talked about. So the stigma was there because there wasn't the conversations, it wasn't normalized. Like Michael just said about actually talking about your emotions as a strength and not a weakness. But like the guys are literally getting told to leave their emotions at the door before they go into playing a game or into training. And so I think still very much that culture of not talking about your feelings, or if you do, it's because it's something wrong with you and you need to go and see something because there's something wrong, rather than people just being able to express how they're feeling, whether it be that they're frustrated that they didn't play well or elated because they won. And so I think that's the overwhelming. I asked one of the guys the other day, like, what would happen if you'd had another player come into the locker room and talk about their mental health journey, and he said, I would have listened. And so for me, I think that kind of encapsulates the fact that that hasn't been going on, that isn't going on, and that isn't the norm. And so I think, there's the stigma still around mental health, but also I think there's just not that normalizing culture going on. And that's not just about the other players, right? That's about the coaches too. Like we've all seen the videos in locker rooms of coaches maybe losing their cool, but in terms of just being able to have a one-on-one conversation about self-care, about, having a difficult moment at home, or how, that kind of play or that loss really affected you. So for me, I think it's like, yes, there's the stigma, but two, there isn't that like normalizing culture of just talking about their emotions. And something kind of almost magical happens in therapy, that when one person starts to talk about how they're feeling, it takes a few weeks. We're a big group. Sometimes there's like 10, 12 guys, but you'll have someone like Michael that's more experienced, and then you have new guys coming in that are pretty quiet. And just by being there, witnessing other guys opening up and listening, oh, it's actually okay to be able to say, I'm feeling like this. That's where the progression happens. When we put it in an arena like group therapy, where it is, and it starts to, then we see just such a progression in being able to learn that emotional literacy, being able to talk to each other, being able to challenge, being able to compliment. So yeah, I feel like, there's that big cultural aspect for me, and that learned behavior as well.
That's amazing. And you're meeting people where they are, right? And everybody's at a different place in their journey and in their understanding or insight, but you create the space. And that's what I felt at APN too, like walking the halls, like in the group area. It was just a good, healthy space for that to happen. And Courtney, I guess go back to your collegiate days and, soccer. I mean, was this something you were thinking about when you were playing at an elite level as well?
Truth be told, not at all. And I think, when we're talking about whether it's structural barriers or the stigma overall in general, I really do think it's both of these factors at play. Because when I think back to when I was at Ole Miss, I don't know if I would have even known how to essentially initiate and or access mental health services, or just to simply go and talk to a counselor. In my role now as a mental health provider, particularly from a collegiate lens, I feel very blessed to work for a university like Texas Christian, because they truly, truly do prioritize the mental health of their student athletes. Anywhere from workshops for the student athletes to the coaching staff, they're providing education to the teams about things like suicide prevention and other clinically relevant topics. In terms of access and confidentiality, I genuinely appreciate their setup. My office is actually located in the basketball arena. And so attached to the arena, they have a cafeteria and they have rooms for tutoring and study hall and things things like that. And so the student athletes could be going to the arena for a whole plethora of different things, and no one's really going to think twice per se as to, oh, are they going to see, a counselor? Are they going to see a mental health provider? So I genuinely have appreciated TCU's thoughtfulness and intentionality behind how they have things set up.
And there's a rivalry there, right? Still SMU, TCU. That's still a thing.
That
So
is
I don't
still a
want to I
thing.
don't want to make it one versus
Yeah.
the other, but and you're pretty young, right? So even you said this wasn't even on your radar, but like, were you as a collegiate athlete, was there a pre-participation mental health screen?
I don't think
You
so.
don't remember it?
I
Yeah.
don't think so, but that could be my memory failing me.
And it's not like surprising. I don't want to get anybody in trouble, but
No,
like
no, I
this
I
is
just if it was, it certainly did not stick in my memory, but I do truly remember being a freshman at SMU, going from playing club soccer. I was always on a very highly competitive team. We traveled, and as a lot of freshmen experience, when you get to your freshman year of college, it's sort of a wake-up call. You're kind of at the bottom of the totem pole again. There was definitely some really difficult times. I've always had a very close relationship with my father, and there were definitely phone calls to him where I was essentially emotional about not getting minutes or not getting as many minutes as I would have anticipated. And it's a hard transition. But looking back on it, had maybe mental health been just in general maybe talked about a little bit more, or just how to access services essentially. I mean, I can't guarantee that I would have taken somebody up on the offer, but I might have been a little bit more curious maybe, or taken it a little bit more serious in terms of consideration, just to simply go talk to someone and have that person be a listening ear for me and just a sounding board as I was navigating that transition from high school to college.
So that was a good call out, Tommy. Thanks, Courtney. Tommy, Courtney is not a geriatric millennial like us, but also she didn't just finish college. So back then, that this wasn't part of the normative conversation. So but you touched on both things: the approach to collegiate athletics as well as professional. I'm wondering, the three of you, are the barriers to receiving care, seeking care, do you find them to be different between the pro and collegiate space?
I can actually just kick that one off. So there's always going to be a certain level of stigma at all levels of sport, perhaps a greater amount of it when an athlete is playing or has played, like Michael, for instance, at the absolute highest level. So for these professional athletes who are often constantly in the spotlight, there is hesitation to seek help with this underlying fear that someone's going to find out about it and it's somehow leaked to the public. And even if you have an athlete that is brave enough to actually enter treatment, this stigma that we're often discussing can essentially follow them. And what I mean by that is when they actually come to treatment, they can be oftentimes very hesitant to open up and to share and to be vulnerable, because they're thinking, is someone going to find out that I'm here? Is this information going to be leaked, to the media? They might also be thinking to themselves, can I really and truly trust my providers and my treatment team? Meaning they might be thinking to themselves, do my providers really have my well-being and my best interest in mind?
Thanks for that, Courtney. I do wonder, yeah, Roz or Michael. Michael specifically,
yeah.
like obviously having lived experience, been an athlete yourself and a coach, like how do athletes actually talk about mental health among themselves?
I don't think it's very much spoken about. Especially when I was playing. I think it's gaining some traction now, especially with all of the suicides that you're hearing about in the NFL and that are continuing to happen. But I would still say, even as a coach being in that space, it wasn't so much talked about as much as I'm just going to tell somebody I love them. I'm not going to ask them any questions. I'm not going to try to pull out anything from them that they haven't already offered up. I'm just going to tell them how I feel in that moment. That moment is a moment, and then that moment is gone just like every other moment, and then you move on with life, and then everything just takes its place and we're back to work. And so I don't think it's talked about very much. I was going to go back to what Courtney was saying about vulnerability. We're trained to have this hard exterior all the time. And in order to get to that vulnerable place, you have to take that off. And as people, I think in our generation, our parents, right, all we heard growing up was stop crying, cut it out. You don't need that. And then it gets reinforced when you become an athlete. And every coach I'll never forget, I'll tell a quick story. I was literally sitting in front of a coach, breaking down, crying. And he kept asking me, what are you crying for? Like, what's the problem? Like almost like belittling the emotion that I had at that moment. And so then I'm going to put all that hard exterior back on because I don't want you to see me like this anymore because I'm not normal when I am. And then I think the trust part is huge. Like Courtney said, not only are you worried about it getting to the media, you're worried about it getting back to a coach, right? These therapists that are in the building, they got somebody to answer to. And if an owner or a coach or a GM asks them a question, are they going to tell them that they can't talk about it, or what are they going to say? And so that becomes a major issue in the NFL locker room. I don't trust anybody. Like as a player, I didn't trust anybody in the building because I was always worried about, well, the head coach is the head coach and he and the GM make sure that everybody gets their check. So if you're not bringing back the information I want, there's a consequence. So that trust part of who can we talk to? Different therapists go with different people, connect with different people. Well, there's only one in each NFL building. So that one may not connect with these other, he or she may connect with one or two or three or four or five people, but they don't connect with everybody. So it's just, and it's amazing because you have a team of massage therapists that are in the building. You're going to bring a team of chiropractors in the building, but you have one mental health therapist in the building to talk and treat the most important part of our body. So I think the trust part is big, and I think having multiple therapists in the building to be able to connect with different players is a major thing.
Michael, there's a ton of truth in that. All of that resonated with me. I think what you just said, it might come out as the one-liner, that we highlight here. But, the trust, I think the ironic thing is the more you embed services within an organization, and you do that more at the professional, major league professional level, because the resources are there and you want to help the guys. But it's ironic because there's dual agency. And I think, Mark, you and I could probably do a whole episode just on that and how to navigate that. Ros, I'll kick it to you. You're working with athletes that are worried about confidentiality. How do you address that in a individual or especially a group setting? Maybe group's easier because it kind of breaks down because everybody's there, sharing with each other, and it's easier to share with a peer than it is, a therapist who you don't know. But how do you do that? And then maybe second question to that is, Michael's talking about different types of therapy, right? How are we assessing athletes that might benefit, triaging them to a CBT approach versus a ACT approach versus something else? Like how do you go about that as well?
Two massive questions. But let me address with the confidentiality. I think that's a really important part. And I think kind of goes to some of the barriers that we kind of started talking about when players are playing. As licensed therapists, we're all bound by HIPAA and confidentiality, but it's not uncommon for me to hear, I went to see a therapist and the next thing I know I was cut, or I went to see the team therapist and my coach came to speak to me, and we don't know what went on in those situations. But as far as I'm concerned as a therapist, whether I'm working with athletes or non-athletes, I have a duty to my license and my profession in terms of confidentiality and respecting the client unless it is a life or death or urgent situation. So the way that we manage it in residential, because in residential treatment, athletes are in treatment with non-athletes, and the NFL is very popular here, and so we make sure that all of the people that come to treatment sign non-disclosure, that they're very aware of the rules and the reasons behind that, and that goes for anyone that we have in treatment, that just about that level of respecting each other. And I think it's a really important part of group therapy, of respecting individuals' opinions, confidentiality, and as therapists it's really important for us to take on that leading role and model that. In group therapy, it's exactly the same. We run a telehealth therapy, so we really lay down those expectations. But from the moment anyone comes in. Our stories are unique, but being able to be in a group with other people that have lived similar experiences, I think it already breaks down some of that concern about confidentiality, because these are guys that suddenly someone will come in, they're like, I played on his team for like 2 years, or we went to college together, or I watched you on TV. And I think like they already have this unwritten kind of mutual understanding because they've been through similar experiences. And I say they loosely because it's no different to, we have a veterans track and people that have been through combat experience, for example, because it's about that shared experience. No one's expecting anyone's experience to be the same, but I think there's just that understanding, and you can physically see that relief of, okay, well, this dude knows somewhat what I'm going through. Speaking to that confidentiality piece, I think it's more difficult with current players. I think once you've retired and we're on this journey, it's a little different. But I think being in the spotlight, being watched by millions, we talk a lot about that. I did a session on personality last week and thinking about how people view themselves versus how they're viewed by others. You're being judged. You drop a ball, you're being judged by like 40 million people a week. And so, that level of anxiety around confidentiality, around, what others are going to say about you, I think is much higher when you're playing and you're playing a both professional, but we see it a lot more in college now with NIL, becoming that celebrity status. And I don't want to talk for too long, so I'll move on to choosing the therapy. Like, the ideal is people coming to residential, right? What a great experience to be able to just come and reset. Let's be really clear. People are not coming against their own will. People are choosing to come for treatment and are able to come and just have that time out, the time out from the media, from social media, from family and friends, because there's a lot of pressure and change in dynamics for athletes in different levels of their career. And so when they are and they're able to experience multimodalities, different kinds of treatment. And for most of our players, it's maybe the first time that they're experiencing therapy or a consistent level of therapy. So they're really able, and Michael, I'm sure can speak to this, like have opportunities to try different types of therapy and kind of find what works for them. Just like, I always advise people to interview their therapist, try a few. It has to be the right, this is a really important relationship. Like I've had some clients for, 7-8 years at a time. It's an important relationship. And so I encourage to interview your therapist, your psychiatrist, whoever it is, to be able to have that trusting relationship, because it's so important. And I feel like that with therapy. Sometimes as therapists, we try something and it doesn't always work. But as long as there's communication about that, I think that's the most important thing. So in group, we'll go from trauma-informed care to CBT. We do a lot of somatic work with athletes. Like, we're so in touch with our bodies, right? We think and feel with our bodies as athletes. And so somatic work is kind of the number one avenue I go down, just from being an athlete myself. I know how much I kind of feel my emotions, if that makes sense. And so yeah, it's about using a multimodality kind of perspective and letting the athletes have choice. And one thing you'll hear time and time again is, for a lot of especially pro athletes' life, they don't have a lot of choice. A lot of choices are made for them. And so when we get to the therapy arena, I'd like to be able to rewrite that script. This is your choice. It's your choice to come to therapy. It's your choice, your frequency that you come to therapy. It's your choice, your therapist that you see. And so I think that is really important.
Yeah, the coaching's all very paternalistic, very much you're gonna run this or do that and lift that. And therapy, hopefully that you're giving them agency and autonomy to say, yeah, I'm ready for this, or I'm ready for that. But I've heard the word trust, I think 6 or 7 times. So like maybe that's a theme here, right? And also, Courtney, you had talked about like peer-to-peer support. I mean, we've had Mark on this show, Steve Wheatcroft, Monte Ball, athletes that just rave about the peer-to-peer support, and that helps tremendously for building trust with the therapist or whatever the mental health provider might be. And maybe, Courtney, is that your experience too? And how much is that a part of APN? And how much do you see that benefit the trusting environment?
So I was talking with a group earlier today, and I really do genuinely believe that we all essentially have our place in this work. You don't necessarily have to have a full clinical background to have a significant impact in helping these elite athletes through their struggles. For instance, for All Points North, we have a global ambassador. So Marcus Smith, you and Mark were able to meet him at the CE event that we did last year. Now, it's actually ironic I'm kind of saying this because Marcus is, in all actuality, going to start working towards a social work degree. Now, he's kind of in the beginning stages of that. I know he's really excited about that, but just for the guys to have him as a layer of support and an advocate to talk to, I think is hugely advantageous. And again, just earlier today, I was chatting with a group and I made the statement, and I truly am a believer in that. I personally feel that if an athlete is struggling, to hear somebody like a Marcus Smith, who has been in the NFL, who has played at the elite level, to pass on, whether it's words of wisdom or advice or support, I think for myself, having a clinical background, that information is going to be more impactful in all actuality coming from that other elite athlete versus myself, because there's that sense of relatability. And yes, I can certainly be empathetic to struggles and into challenges, but at the end of the day, ultimately, I cannot say that, I have lived experience at the most elite level. And so I think somebody, whether it is whether it is peer-to-peer support or a life coach or something like that has played with and against the best of the best, is going to be hugely impactful in terms of providing support to an athlete who is struggling.
Yeah, that's special. And sorry, Mark, I'm just going to keep going because
Please.
that's another irony for me, not being a professional athlete. I try to pretend sometimes, but I feel that sense of like imposter syndrome. And then when I talk to a professional athlete, they feel like in the mental health space, they're imposter. I don't know this language. I don't know what you're talking about. So I feel like, ironically, having that vulnerability together creates this like therapeutic alliance that's kind of special, and it's kind of why I like working, with high level athletes. But Mark, I'll kick it over to you.
Yeah, I mean, I've been listening to the past, several minutes of the discussion, and this is like the sales pitch for athlete-specific programming. It's athletes are a vulnerable population. They don't seek help. So if we sort of insert what's been missing in the athletic culture, which is it's okay to talk about these things, and then they hear it from their peers, they're much more likely to open up. I mean, all three of you have touched on that as well as Tommy. So I guess my question is, why isn't general mental health care always enough? Like what are some of the themes that we've talked about in this show, lots of them. Identity. The athletic identity is massive. Like this is literally that's who they feel like they are. That we talk about needing that second balloon. When if the first one pops, well, who are they outside of sports? So I'd love to hear from Michael, having played, having been through this, what's the difference between being an athlete and then just being a person who plays a sport?
An athlete or a pro athlete at this level is every second of every day, right? When I was playing, these coaches, they talk about, man, we work so hard and our time on task as a coach is just, you know, you can't even as a player fathom it. And parts of that's true. And then when I became a coach, I said, the thing that coaches forget about is you don't actually have to go do that. You don't actually have to get out on that court or that field and perform. And the energy can't be fake, right? As a coach, I can fake the energy, act like I'm excited and get everybody going. As a player, you can't fake it. You're out there, you're doing it. If you're faking it, it's a problem, right? You're not going to be the best version of yourself.
Roz, I wonder we're talking about athlete specific programming. How does curriculum and structure in these groups that are athlete specific address these issues?
Yeah, I just realized that we've lost Michael. But that's a good question. It's interesting. I ran just a talk for NASWA, the National Association of Social Workers, a while ago about sports social work and what it meant to be a sports social worker and what it took. And I'd said, do you work with trauma? Yes. Do you work with grief and loss? Yes. Do you work with identity? Okay, well then there's a great start to work with athletes because, athletes go through a lot of trauma and a lot of grief and loss. I would say they're the common themes when we talk about working with athletes. And so I think if you understand from a trauma-informed lens, how to address working with anyone, and then you put it in the athlete specific, because there's a lot of common themes. And especially for athletes that are pro athletes that have been doing something all of their life, right? We're not just talking about the loss of the sport, of playing and the adrenaline that comes from that. We talk about that, but we're talking about a loss of our community, our family. We talk all the time about the locker room vibe, those coaches that were influential, also how family relationships change. And so I think it's about planning for a curriculum that focuses on those broader topics, but in an athlete specific way. So the grief and loss is a really big part. And then the identity and discovering who we were and who we are now, and how that's changed, and how do we come to terms with the new normal. And a lot of that is about going through the highs of the highs and the lows of the lows. So if you liken it to working with someone that's, has a substance use issue, where we're chasing those highs, those real highs, and we're experiencing those real lows. It's learning to teach or work with athletes to understand, like, a really good day could be a day where we've got out of bed, we've taken our kids to the park, and we've just not had a panic attack, right? Whereas a really good day when we were in the NFL was scoring a touchdown or winning on a Sunday. It was these really big adrenaline kind of dumps. And so I think in terms of curriculum, do I do different as a therapist with my athletes and non-athletes? Yes, but I'm still working with those common themes of trauma, grief, loss, and identity. And so I think it's about those being specific to athletes, to those, those kind of common themes, but putting them in kind of athlete specific ways. But the other thing I will say that's been really important is group is encouraging and allowing our athletes to have a voice. And that takes a little bit of time, because we're talking about athletes that have felt very silenced, not able to have their voice or at least speak their truth. And so when it's not common to be in a locker room of guys, which is what group therapy often feels like, to speak their truth, is like, how do we facilitate and encourage that? And a lot of that is modeling. I could talk all day, every day about athletes supporting each other and that kind of mentoring role and that ambassador role. That's absolutely my thing, and the storytelling and how important it is. But I do feel very much that it's about how do we create a space, and I don't want to use the word again, Tommy, it's like bingo, but a trusting space then to be able to facilitate. And that's the learning for me. That's the therapy, right? It's not necessarily the DBT skill I teach about how do we get back into the window of tolerance and so on. It's about teaching the skills. That's what's saving people, is being able to talk about how they're feeling. And so really it's about, the biggest, focus for me in the curriculum as such is how do we create a safe space where we have, and these are male athletes, let's be really clear, male athletes at the top of their game, we know have not had that experience. So how do we create an environment and atmosphere where it becomes not only the norm, but something enjoyable? And then you see a transformation, and then you see the guys being able to relate and be able to feed back and give each other flowers, and at times challenge. And that for me is kind of the magic, and maybe some of the differences about working with athletes, and maybe where my focus lies.
Yeah, it's hard to describe the magic, but I liked watching you light up about it, Ros. And I'm thinking of the respect in that room. I might go back to something Michael, I think, was talking about before, and we lost him for a sec, but we're glad to have you back. I think of Theodore Roosevelt, The Man in the Arena, if you guys have read that. It's like your coaches, your, spectators, they can try to fake it as much as possible, but the man in the arena, or the woman, for our female athletes, they're in there blood, sweat, and tears. I guess my question to you, Michael, is how does that resonate different when you're in a room with other athletes or former athletes and doing this kind of work?
When you say that, how does it, like, what do you mean when you say, how does it resonate?
When you're in that group setting that Ros was describing, there's again, going back to trust, going back to that, I think it's a force multiplier when you're oftentimes working with who can relate to you and relate to where you've been, and you're addressing subjects that maybe have not been addressed before. versus one-to-one therapy where you're with a therapist that might not have walked in your shoes?
Yeah, I think in a group is powerful. You're given power. I've said this to Roz before. Our group delivers what we need in those moments of needing, right? So there's a day I'm on there and I'm struggling. I got a lot going on in my mind. I got a lot going on in my personal life. And I'm not all the way there. But because you show up, everybody in the group, it's almost as if because we're all in there, we see each other, right? My wife says all the time, like, do you see me? Right. I want to be seen. And I feel like in our group, we see each other because we've been through some similar things. We share similar feelings. And so when a person's down, we're able to grab them as a group and virtually hug them, wrap our arms around them with our words and our emotion. And it's almost like we all raise our hand. And not only have we been there, but even if we haven't been there, we want to feel like what you feel when you're in those places because we want to be able to relate to you. We want to be able to be there for you. And so I think it's a group that's full of power and full of love because we care about each other. We care about seeing the growth and the impact that comes from the group. I think individual therapist is a little different because when you're with somebody individually, at least for myself, I was a little bit more apt to divulge more information, be a little bit more vulnerable because it's just her and I, right? Or him and I. It's not a group of people, right? And I think there's also that part when you're with your peers, you almost sometimes at the beginning, you'll feel judged, right? That was our life as an athlete was being judged. Are we good enough? Did I do this well enough? Is this enough? You kind of go in there and you're wondering if I say the wrong thing or what are they going to say? How are they going to look at me? And then you have the leaders in the group that'll step up and say, hey, this is what I'm going through. This is what I'm dealing with. And then, okay, now the other guys are more apt and more willing to speak up as well. And so I think it just creates more conversation. I think it creates more vulnerability, which creates the connection throughout the group.
Yeah, that's great. I think we've set the stage a little bit, Mark, if you want to take us to the transition, but we've talked already, about an area where a lot of athletes and just frankly, the general public doesn't know much about this. And so, I think we've talked about trust enough. Maybe let's start getting into a little bit more of the practical how to.
Yeah, I mean, we touched on a ton of topics. Thank you all for this. I mean, the importance of a space that feels comfortable to share vulnerable parts of ourselves. So, depression can be incredibly isolating. It feels like you're the only one going through it. But if you see your peers that are like you, i.e., athletes that are also going through this, you feel like, oh my God, we're in this together. It's not just me. You're much more likely to be able to actually get something productive done. And that's why socialization and connection is so important, which is a good segue to our next segment when we're going to be talking about group therapy. So I think this has been an incredible start to this awesome discussion. In the next episode, we're going to be taking a deeper dive into group therapy itself, why it works, how it works, and what athletes actually get out of it. And we're going to be talking about practical solutions, how to get athletes engaged, and close with some advice for coaches in the next generation. So stay tuned, and thank you for listening to the Peak Sports Psychiatry Podcast.